So today's topic is modes of intervention. Intervention means what actions can be taken to alter the natural course of a disease. Means what steps should be taken so that the disease should not take the means the phase of an outbreak, or it should not become any epidemic. So these actions can be medical care, education, social support, environment improvement, or and it is designed to promote health, prevent illness, or reduce the impact of disease on community. So mainly the interventions can be taken as like 5 stages, and each stage corresponds to a different phase in the development and progression of a disease. So these 5 stages are health promotion, specific protection, third is early diagnosis and treatment, fourth is disability limitation, and fifth is rehabilitation. So, what's health promotion? Health promotion means we are focusing on enhancing overall well being and empowering the individuals and communities to take control of their health. So, it involves health education, community development, policy, advocacy. So, examples of health promotion are like having the anti smoking campaigns, nutrition education, and mental health awareness programs. So, number two takes as specific protection. Specific protection means we are targeting the known risk factors or the disease agents to prevent specific illness that involves immunization, fortification of food, environmental safety measures. Examples are again vaccination and use of helmet and seal belts while traveling, and iodization of salt to avoid goiter. Early diagnosis and treatment, it aims to detect disease in its early stages and initiate prompt treatment to prevent complications. And it involves screening programs, case finding, diagnostic testing, immediate therapeutic interventions. Examples include mammography for breast cancer, blood pressure screening for hypertension, and early treatment of tuberculosis. Next one is disability limitation. Disability limitation seeks to reduce the severity and progression of disease related impairments and focuses on preventing further damage, preserving the functionality of the individual, and slowing down the disease progression. Examples include insulin therapy for diabetes, physiotherapy for stroke patients, and pressure sore prevention in bedridden individuals. Next, we have rehabilitation. Rehabilitation aims to restore the function and improve quality of life in individuals with chronic illness or disability. And it involves medical rehabilitation, psychological support, vocational training, and social reintegration. Examples are prosthetic fitting for amputees, speech therapy for post stroke aphasia, and job placement programs for disabled individuals. So now we'll do these 5 strategies or stages one by one. The health promotion. The process of enabling people to increase control over and improve health is known as health promotion. So it is a proactive and empowering approach that focuses on enhancing the overall capacity of an individual and community to maintain and improve their health. So, unlike disease specific intervention, it aims to strengthen the host through a variety of supportive strategies. So, core philosophy is that it is not targeting any specific illness, it is focusing on building overall health asset, and it is encouraging self efficacy, community participation, and positive health behaviors in an individual. So when we talk of health promotion, what key interventions do we talk of? We talk of behavioral change, we talk of environmental support, and policy level action. So it requires a blend of interventions that which addresses social determinants of health, foster healthy lifestyles, and create supportive environments. So key interventions we can say as health education, environmental modifications, nutritional intervention, and lifestyle behavioral changes. So in this one by one we have explained this also. Now in case any question comes on health promotion, so we should have the content to right also, है ना? So health education, environmental modification, nutrition interventions, and lifestyle and behavioral changes are also done one by one. So health education. So what is health education? It is cost-effective interventions in public health. How does WHO affirms this? Like it is extension of benefits of medical, psychological, and related knowledge to all people, which is essential to the fullest attainment of health. So, it is a core pillar of health promotion that is aimed at empowering the individuals and communities through systemic dissemination of knowledge and development of practical skills. So, educational initiatives can be included to means it can be given to a wide range of audiences like public, patients, priority groups, healthcare professionals, community leaders, policy makers, and decision makers. So, what is the purpose? It is only to increase the awareness of health risks and protective behavior, to encourage the responsible choices, and to build the capacity for disease prevention and health advocacy. So now, how does this health education works? Like, what are the key modalities? So we have school-based health curriculum, which integrates health topics into formal education for children. It covers hygiene, nutrition, mental health, reproductive health, and substance abuse prevention. It promotes lifelong healthy habits from an early age. Then comes your public awareness campaigns, which it utilizes mass media, posters, social media, and community outreach. It addresses specific issues like tobacco cessation, vaccination, sanitation, and mental health issues. And it reaches the diverse population with culturally sensitive messaging. Third comes counseling and workshops. It offers personalized guidance and interactive group sessions through dialogue, role play, skill building, and it can be implemented very easily in schools, clinics, workplaces, and community centers. Next, we have environmental modification. So, environmental modification is an essential component of holistic health promotion strategy, where it is aiming to create physical and social conditions that support healthy living. So, these interventions are non-clinical, but it have the direct involvement of the community. Though the medical professionals are not required, their direct involvement is not required, but they play a very transformative role in disease control. So whenever any patient goes to a doctor, whatever the doctor suggests, or whatever one point as a healthy point for environment also, if he says, then it the patients, if he listens, it gives a very good support to the environmental modification. Like the person who is not going for any physical activity, if the doctor says ki yes, gardening is good for you, and you just plant the flowering plants, and it would give you a very healthy habit, and your this disease will also be cured little bit. It would give a very emotional impact on the patient's lifestyle, impact on his ideology, impact on his thought process. And if he starts this gardening, his depression, his anxiety, his frustration, these all things will also be gone. So this is one thing where medical professionals can give a very good help to the environment through their profession, and just saying only one line or suggesting only one step to the patients to work towards the environment, right? So this does not require a very means pop and show infrastructure and all, and just telling what to do or what to not do. This one step will give a very good modification in the environment. So what is the purpose? It is the purpose is to reduce the exposure to disease causing agents, promote safe, clean, and healthy supportive surroundings, and it is empower communities also through structural and policy level changes. So what are the examples? Examples are provision of clean water supply, installation of sanitary latrines and waste disposal system, control of disease vectors, improvement of housing conditions, creation of smoke-free public spaces, and access to parks, green zones, and recreational areas. So these interventions form foundation of public health infrastructure, contributing to long-term disease prevention and improved quality of life across population. Next comes your nutritional interventions. Nutritional interventions are again very good, very vital component of health promotion, and it ensures that adequate dietary intake is there for the population, vulnerable population, preventing malnutrition and supporting optimal growth and development. These interventions are again non-clinical and focus on population level strategies to improve nutritional status across all age groups. So various programs were like launched before also, like food fortification, child feeding schemes, and they have played a pivotal role in reducing micronutrient deficiencies. It also enhances the immune resilience and improving cognitive and physical development of an individual. Purpose is again to promote balanced diet and nutrition rich food choices, prevent nutritional deficiencies and growth related disorders, and improve the health outcome of at risk groups, including children, pregnant women, and elderly. Examples: food fortification, school meal programs, nutritional labeling and awareness, and targeted feeding programs. Next, we come to lifestyle and behavioral changes. So, these are also a very essential component of preventive health. They are aimed at encouraging sustainable habits that reduces the risk of disease and promoting long-term well-being. It includes cessation of smoking, regular physical activity, stress management, and responsible alcohol use. So, if it is adopted consistently, such behaviors can lower the burden of non communicable diseases and improve overall quality of life. So, what are the interventions for this? We have multi-level interventions like organizational changes. Example like workplace wellness programs should be there. Political actions like tobacco taxation, alcohol regulations. Social initiatives include peer support groups and community outreach programs. Economic incentives include subsidized gym memberships and healthy food vouchers. So together, these interventions aim to create supportive environment that make healthy choices easier and more accessible. So by integrating this behavioral science with public health planning, lifestyle changes can become uh, not just any personal decision, but it can bring a very collective movement towards the better health of the community. Next, we come to specific protection and health protection. So, what is specific protection? Specific protection refers to targeted interventions designed to prevent the onset of a specific disease or any health hazard. So, goal is to eliminate or reduce the exposure to known risk factors before the disease occurs. So, while complete disease prevention is rarely feasible, specific protection plays a critical role in minimizing the vulnerability of an individual and interrupting the transmission pathways. So, examples include like immunization. Immunization means we are preventing infectious diseases through active immunity. Use of specific nutrients, then we are by this we are preventing deficiency disorders like use of iodized salt we are using for avoiding the goiter. We are using iron for anemia. Then is chemoprophylaxis, use of drugs to prevent the disease like antimalarials and antibiotics. Protection against occupational hazards means you are using PPE, specific ventilation protocols, safety protocols to prevent work related illness. Accident prevention means safety regulation, helmets, seat belts use, and hazard signage. Protection from carcinogens, it is avoidance of tobacco, asbestos, and other cancer causing agents. Avoidance of allergens, it reduces exposure to triggers like pollen, dust, or food allergens. Environmental hazard control, it means that we are using any measures to reduce air pollution, noise pollution, and any chemical exposure. Lastly, we have consumer product safety, which means we have regulations of food, drug, cosmetics to ensure quality and safety of the people. So when these are all implemented through national programs, any legislations, community outreach programs, it requires intersectoral coordination. Right? So specific protection, it is targeting defined risk factors. Health protection is comprehensive concept. Means specific, we are specifically targeting on anything, and health protection means comprehensive care given for protecting our health. So it refers to creation of conditions that support normal physical and mental functioning of the individual and communities. So according to WHO, it means provision of conditions for normal mental and physical functioning of the human beings individually and in the group. So this definition also highlights the holistic nature of the uh, disease, or holistic nature of the health, right? So examples may be like food production and security programs, literacy initiatives, safe housing and sanitation infrastructure promotion, access to clean water and energy, universal health coverage, and financial protection. So here we have the comparative insight also for this specific protection and health protection. So specific protection focuses on narrow and disease specific things, while health protection is holistic approach. It prevents specific disease while it is promoting overall health and overall well-being. It examples are vaccination, or specifically if we say that allergen avoidance, but health promotion can be one of the thing for health protection. So health education, sanitation education, then food security, these are all the examples of health protection. So how do we approaches targeted approach for specific protection, while we have multi-sectoral approach for health protection. Then individual and population, both at both the levels we can have this specific protection, but health protection can be done at community level also, right? So next we have early diagnosis and treatment. This is the third step. So WHO expert committee says कि early detection is detection of disturbances of homeostatic and compensatory mechanisms, while biochemical, morphological, and functional changes are still reversible. So this definition emphasizes the importance of identifying the disease before the clinical symptoms occur. So when interventions can still prevent progression to avert the illness or disability. So what is preventive or curative perspective? So early diagnosis and treatment are not strictly preventive, means the disease has already begun and now we have to halt the progression, reduce the transmission, and prevent the complication. So this is particularly relevant to secondary prevention approaches, right? So we are just avoiding that long term consequences may not occur. So what is the application in public health? We have screening programs, we have case finding, routine health checkups, and community based surveillance. Now, what are mass treatment strategies for this? We have certain terms for it, like what is total mass treatment, juvenile mass treatment, or selective mass treatment. So these are different types of mass treatments. Now, total mass means entire population is treated. Juvenile mass treatment means only children and adolescents are treated. Selective means only high risk groups are treated irrespective of their age. So these strategies are tailored according to the epidemiological profile of the disease, and it aims to interrupt the transmission and reduce reservoir of infection. Like COVID-19, we had total mass treatment. The entire population was vaccinated. Then comes your disability limitation. Disability limitation is a critical intervention, and it is applied when the patient presents during the late pathogenesis phase of a disease. Means the symptoms are already there, but and the onset of impairment is in danger, but still fully he is not fully disability hasn't come, but he is on the danger or the borderline of onset of impairments. So what is the goal is to delay, reduce or halt the progression from impairment to disability, so that we can preserve the functional capacity of the individual and prevent long term dependence of that individual to his society or family. So conceptual framework is what, like what disease causes impairment, impairment causes disability, and then disability causes handicap. So impairment means any loss or abnormality of psychological, physiological or any anatomical structure or function. Like for example, loss of limb, visual or hearing impairment, cognitive deficits, impairments. So these can be impairments category. Disability means restriction or restricting the ability to perform the activities, day to day activities the person is unable to perform. Handicap, it is a social disadvantage. Disadvantage means it is the result from like impairment or disability. It prevents the fulfillment of a role that is normal, means he is highly dependent on the family himself. Then we come to rehabilitation. Rehabilitation is defined as combined and coordinated use of medical, social, educational and vocational measures for training and retraining the individuals to highest level of functional ability. Means it is aiming to reduce the impact of disability, restore his independence and facilitate social integration for individuals who are affected by physical, mental or social impairments. It is not merely a post treatment add on, but it is a core component of comprehensive health care, especially in chronic illness, injury recovery, and disability management. So, what are the dimensions? Again, it is a multidisciplinary process, and key dimensions are medical rehabilitation. So of course the medicines are given, any therapies which are required that are given to the patient, surgery if required that is provided, that is done, and any use of assistive devices that is also given to the individual or the patient. Vocational rehabilitation means rebuilding the capacity to earn a livelihood through any skill training and job placement of that individual, so that he may not face any mental health issues at least. Next is social rehabilitation, means re-establishing the family and community and interpersonal relationships, so that he is not exhausted from his social environment. Next is psychological rehabilitation, means we have to try to restore his self-esteem, his emotional stability and personal dignity. So various specialities are involved in this type of rehabilitation, like physical therapy, occupational therapy, speech therapy, audiology, psychology, psychiatry, social work, educational support, career counseling and placement services. So examples are like opening schools for the blind, providing them braille education, supplying mobility aids for individuals with paralysis, performing reconstructive surgery for leprosy patients, and using graded exercise for neurological disorders. So overall, the aim is to transform the dependency into productivity. But what are the various challenges in this. So challenges comes because to provide like training to the disabled, we need skilled professionals for across disciplines. We need community and family support, we need financial investment, policy commitment, infrastructure, and accessibility to all these things. So it is not just medical responsibilities, it is also societal commitment which just protects the dignity, the personal dignity of the individual. Right?